Mr. Jones, my name is Melissa. I'll be your student nurse today. So first, can I have you say your full name and birthday? Alright, excellent. Well, Mr. Jones, we've been noticing that you've been having some trouble swallowing lately. So we're going to be inserting a nasogastric tube, and that's just a small, thin tube that's going to be going through your nose and down into your stomach. So first of all, I am going to listen to your vowel sounds. Alright, excellent. Everything sounds good. So that's just to make sure that once the tube feeding is going that you'll be able to digest the food. So now can I have you cover one nostril for me and breathe normally, and then now do the other nostril. Alright, which one were you able to breathe through better? Your right one? Alright, well that's the one we're going to be putting the tube through. And so this procedure, I'm going to have you first tilt your head back, and I'm going to insert the tube into your right nostril. And then as soon as you feel it in the back of your throat, I'm going to have you tilt your chin forward, and then as you swallow, I'm going to be advancing the tube. So, any questions so far? Alright, I'm just going to measure this. Alright, and now you may feel like you need to vomit, which is completely normal. And so that's why I have this basin here. And so if you do feel like you need to vomit, just go ahead and give me a little wave and we'll stop, alright? Okay. Alright, now I'm going to just move this tube, and then we'll go ahead and get started, right? Get this thing over with. Okay. Alright, so now I'm going to have you tilt your head back for me. Here we go. Alright, now I'm going to have you tilt your head forward and swallow, 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 and swallow, swallow. Alright, good job, Mr. Jones. Now we're just going to tape it so that way it stays in place now that we have it where we want it. Alright, and just one more piece. Alright, and now we are going to check your gastric contents, and that's just to make sure that the tube is in fact in the right place. Alright, it's green, which is exactly what we want. And now I'm going to be checking the pH on this piece of paper over here. Alright, the pH is 3, which is exactly what we want. But just to make sure that the tube is in fact in your stomach, we're going to have you sent down to an X-ray. And then once that is confirmed that it is indeed in the stomach, then we're just going to go ahead and start your tube feeding. Alright? Do you have any questions for me? Alright, well you have a good day, Mr. Jones.